Instagram also and YouTube also. So let us start our session. If you have any questions, just checking the Instagram live. Yeah, Dr. Dia has joined in. So we are live on both. Of course, there were questions on my WhatsApp chat, but let us have first the questions on what is there on the YouTube. Or before that, I'll take a case, a very interesting case. I had a case of migraine, a very interesting case of migraine which I cured with homeopathy medicines. And typically, I always say when the symptoms correspond and your case taking is good, the remedy automatically will fall in its place. So I hope everybody joins in early. Dr. Vishal, Dr. Tanmay, Dr. I think Rajendra is also there on Instagram. Dr. Meera is on and Dr. Baba on YouTube. So let us start immediately. And there was a case of a very interesting case of migraine, and the patient had a typical interesting symptoms about that disease. Whole case taking was done and we got some beautiful symptoms of the patient. It's important to understand, what symptom we took for prescription also. The patient had a typical symptom. Yeah, welcome Dr. Indrajit. The patient had a typical symptom that there was so much pain and there was so much coldness filling the occiput that the patient used to feel as if it was like a freezer. The whole occiput felt as if it was freezed. He had this migraine problem for past 5 to 6 years. He consulted a lot of other doctors and there was no change in the patient's pain. He came to us and was asking few symptoms. Of course, this symptom also was taken into consideration about the frozen feeling. And we could prescribe a very, very interesting remedy, and any guesses for the remedy, anybody? What remedy we thought about? That is, of course, the patient suffered from, and the patient had become like that, did not want to do anything, did not want to go out, did not want to watch TV, did not want to play with the children. And because of the pain, she was so much absolutely dull, calm, and absolutely drowsy. So much pain it was there. This sensation of frozen, this is my third case where I've got the same symptom, and this really helped me to cure that case. I gave a single dose of anybody. Can you get the remedy? Anybody? Sometimes your case taking has to be so good, automatically the remedy comes in front of you. Important is that your case taking should have some PQRS symptom. Of course, there are a lot of remedies for this and a lot of symptoms we take in the case. You repetize all the symptoms, you can definitely get to the remedy. But sometimes, patient tells us something which is very, very individualistic to the patient, but because we have not read the Mater Medica or the repertory, we try to forget or try to appreciate that symptom. If you have read Mater Medica, one remedy has a classical symptom, like this. The patient feels as if the brain has freezing sensation, and I gave that patient one single dose of sepia. Of course, the second symptom which I took for the prescription of sepia was amusement aversion 2. The second symptom which basically I took for prescription was amusement. Nothing gives amusement to the patient. Nothing gives amusement to the patient, and that sepia 1M. Of course, Gelsimim is there, Naxomic is also there, 1 mark, but sepia, 2 symptoms I took for prescription. One was amusement, nothing gives amusement to the patient, and second, pain in the occiput, coldness in the occiput as if freezed. So with these 2 symptoms, we prescribed the patient sepia 1M. Of course, see, when you get a classical symptom and you know that it is in the repertory, you can always get the remedy. But to get that classical PQRS symptom, it is very, very important to have a good case taking. That's why whichever doctor who assistants are with me, I always stress that your case taking has to be good. Yeah, I gave you the remedy. I gave you the answer, Dr. Tanmay. I think he's on Instagram. So I basically want everybody to understand that case taking is so very important. If I always tell to my assistant doctors also, case taking, if it is good, then half the work is done. And of course, if you get these type of symptom, then nothing like it. Sepia 1M cured the case. The patient had done EEG, the patient had done scan, shown to lots of physicians for the 5-6 years, but nothing got relief to the patient. Only Sepia 1M single dose cured the case. So next symptom important, basically if you come to our sepia Sepia has very, very interesting symptoms, that will get you to the remedy very, very easily. Of course, CPI is a washerwoman's remedy, CPI is indifferent, and CPI likes dancing, and CPI has menses problem. But that lady did not have any menses problem. So it is very important to look at the other side of a remedy. Sometimes, we try to get to a rare remedy and recently proved remedies because we feel this is a very important symptom. But even the polycrest remedy has so many symptoms which we have failed to understand. For example, in sepia it is written, it rejects affection. A sepia patient rejects affection. Exactly opposite to which remedy I'm talking about, who basically does not reject affection, gives affection. It is give and take for that remedy. The remedy which I'm talking about, the opposite of CPI is phosphorus. So rejects affection. In fact, it is written in a mater medica, sepia cannot demonstrate affection. This is again a very, very important symptom of sepia, cannot demonstrate affection. Yes, phosphorus is right. Cannot demonstrate the affection. Remember always two remedies which I found very, very useful clinically in my practice. The first being sepia, and the second is, a very important remedy, natramur. Natramur also is very close to sepia when the patient cannot, मतलब मुझे किसी से प्यार है, I love somebody, I would like to say thank you, I would like to say sorry, but basically I am not able to demonstrate, or I'm not able to show that I really want to. So this is very, very important, that a sepia patient cannot demonstrate affection. Please write down in your mater medica a very, very important symptom to prescribe sepia or to prescribe natramur. Sir, which book we can learn medicines? See, learning medicine, I would say nowadays there are so many books very easily available on the programs. But then the basic books, I say Clark Mater Medica, Allen's Keynote, or Herring Guiding Symptoms, or Kent, Boric, and then go to the repertory and search some symptoms of repertory which are very, very important. For example, CPM. Yeah, good afternoon, Dr. Disha, Dr. Vishaka. So third, this is symptom. And one more symptom of sepia which you have to remember, and that is anger. A sepia patient gets anger when consoled. Again, very similar to natramur. Now see how sepia is very close to natramur, and again, anger when consoled. If you say natramur, then you must have one remedy which is very important with natramur, is ignitia. So ignitia also has anger when consoled. Natramur also has. Sepia also has. Of course, there are other remedies also which have it, but these remedies are so important. And see, cannot demonstrate affection, so important. आपको कभी लगता है कि मैं मेरे फादर, मदर, भाई, बहन किसको बोलना चाहता हूँ, थैंक यू, आपने मेरे लिए बहुत किया, बट वो अंदर से, इट डज नॉट कम फ्रॉम inside. How will I say thank you, how will I say sorry? And those are very, very important symptom of sepia and natramur. Anger when consoled, this is again a very, very important symptom of sepia. Welcome, Dr. Jyoti. And then if I go forward, you want to have something about sepia, I'll go to the next case. Tell me if you want. Okay. Yeah, Ishani Raval joined. Dr. Jafu, welcome. So again, going with sepia. Sepia has very, very important symptom, that whenever sepia patient wakes up, a sepia patient wakes up with lot of fancies. This is again a very, very important symptom. I've seen sepia clinically wake up with lot of fancies. Now, you just name the fancies and sepia has it. 2 or 3 remedies which are very useful that you must look about for fancies when the patient wakes up. The first is lacasis, second is sepia, and you'll be surprised. Third thing, remember platina. These are the remedies which have wakes up with lot of fancies. In fact, sepia wakes up because of lot of fancies, because it is said that expressing oneself is almost impossible for a sepia patient. Have you ever heard that? Expressing oneself is almost impossible for a sepia patient. This is again a very, very 3 marking symptom of sepia. very close to this the symptom that the patient is expressing oneself is almost impossible. And you will come around lots of homeopathy doctors, basically who are basically very good prescribers, who have good practice, but they cannot express, they cannot show how are they prescribing, why are they and that's why you fail to appreciate those doctors. Yes, Dr. Manisha, welcome. So it is so important to understand expressing oneself is very difficult or impossible. It is sepia, nux vomica, and one more remedy. Remember that remedy, that is again pulsatile also. Okay, we'll stop CP and have some question. So, sir, did you recollect the remedy you prescribed for heart elements in the case? Oh, no, Dr. Disha. I'll make sure that this today I'll see and get the remedy. And of course, I'll tell you the remedy. That is not so important. But the important is how do you get to the remedy? That is so important. Whoever doctor comes and joins me, I basically tell them how to get the remedy. How did I get that rubric or the symptom is very very important. So I'll see today and get back and tell you the remedy. Next, sepia. If you have any questions, you can always ask because I have a lot of things to tell about sepia or any mathematica you want. I can tell. But one thing, sepia is also a remedy which is very malicious, very vindictive to loved ones. This is again a very very important symptom of sepia. Normally, what happens when we tell? Yes, Dr. Disha, I'll tell you. Maybe we'll discuss the case also after some time. So, malicious to loved ones. And normally what happens if this symptom is there, that the patient comes and tells, Doctor, see, मेरा लड़का है ना, my child is very ill-tempered at home, he'll scold his father, mother, his sister, but outside he is very good. Normally we mistake that with Kalikar, who is outrageous in company or very bad at home, or we think about the rubric contemptuous, hard on inferior, soft on superior, and think about remedies like Lacases or sepia or viratum. But sepia also, remember this, malicious and vindictive to the loved ones. Are you getting me? Are you getting me the essence of the remedy? There are so many symptoms that it is so important to understand about that remedy. And sometimes when we make our prejudiced mind, fixed mind that sepia, look at this, then we are not able to get the remedy right. I hope everybody is getting what I wanted to tell you. So could we have some more questions before we go to sepia or any other mathematics? Because some questions have scrolled up on the Instagram. I was just explaining sepia, it has scrolled up. So can we have some questions, or I'll go further in sepia? Anybody? Yes, Dr. Disha, I will tell you the case also and tell the remedy also. How did I get to that remedy? Of course, sepia has that ball sensation and other symptoms. Those are very very important that you have to remember. But these are symptoms which I have found very very useful in sepia, which you should remember. For example, a sepia inquisitive, yeah. So in sepia, one more thing you remember, if a housewife comes and tells you, okay, sir, I have helped the family, I've taken care of my husband, I've taken care of everybody in the life. Now I think that I am so tired, I feel now somebody else has to come and do the job. I just want to sit and rest. And that's why I feel depressed. I do not want to get up in the morning, and I feel what life I have lived. I have lived a life like a housemaid. I have prepared good food, helped everybody, but there is no respect in the family. Now, this is again a sepia. This is again sepia. Now, this symptom, you must remember there are two remedies which are very very important. One is a very very rare remedy, that is bambusa, which also I have used very rarely. But sepia, the symptom in mathematica, is so written beautifully, cannot handle things anymore. Housewives cannot handle things anymore, and that remedy is sepia. So did you get some these type of symptoms in your case taking of a housewife? Maybe she's 48 49 years of old, at the menopause and then she gets this type of symptom, do think about CPR, Very, very important remedy. Have you got these symptoms? Anybody? You can also share your experience, okay? Sir, is it necessary that every CPA should have indifference present? Well, no, Dr. Indrajit, a very, very Indrani. Very, very interesting questions. Now, you see, indifference, if the patient is suffering from a syphilitic disease, then the symptom of indifference is very, very important. Of course, in CPA, you can see indifference in all parts of CPA, but it is not a law that CPA would get indifference every part. If you are just treating a psoric case, a psoric case, so if indifference is still not there, still you can think about CPA. That is very important. For example, if you want to prescribe CPA without having indifference, then you must think about a psoric symptom of CPA, and that is anxiety. And then you must know when is the CPA anxiety more. Okay. If you search the Matermedica, it is written that CPA has anxiety when he wakes up in the morning. When he or she wakes up in the morning, there is a lot of anxiety. What to do, what will happen, what to do, what will happen. And that anxiety of CPA again becomes a 3 marking symptom in psoric cases. Or there is anxiety when the patient has exertion of eyes, where the patient says, oh my God, my eyes is so paining, now what will happen to my eyes? I'll have blindness, or I cannot see properly. I have to wear specs like my father, like my mother, like my doctor. Anxiety from exertion of eyes. And that is again a very, very important psoric prescribing symptom of CPA. So indifference will not come immediately. Indifference is a process of trial of miasm from psora to psychosis to syphilis. This anxiety symptom is such an important symptom of CPR. Wakes up in the morning, or the patient has exertion of eyes from, there's a lot of anxiety. There are a lot of other symptoms of anxiety, but these 2 symptoms I have seen in my practice and prescribed in relation to CPR. Sorry. Yes, I hope Dr. Indril, you got some entry points of CPR. Don't ask. Yeah, thanks. Yeah. So can we have some questions? It's a question answer session. It is not a Matermedica session, So if you ask me some questions, everybody learns. I also learn. But if you ask Matermedica, I'll keep on, and half an hour will pass. I'll not know half an hour has already passed on. It's only 20 minutes up. So let us have some CPA. Welcome, Dr. Najma. So let us have some question answers. Don't get only mesmerized by the Matermedica. Everything is learning, and however Matermedica, it is important to apply that symptom or see that symptom in the patient and then prescribe the remedy. Sir, do tell us of your views about cognates and its alternation in cases. Coagnates. No, see, what happens that not such experience in that. Can you elaborate the question more? If you can elaborate the question more, then I can answer it better. Being very precise, Dr. Indranil. Otherwise, it will be easy for me to get to the CPA and tell, but coagnates is an important symptom. Let us understand coagnates. Can you ask me some more, some detail, specific question? So as you go further, you can have some more beautiful symptoms of CPA which you never thought was present in CPA, but never thought of prescribing. A CPA patient, whenever, this is very important. Sometimes see the precise question. Sometimes 2 remedies are very close and we are confused to prescribe. So should we repeat? Whenever, if you ask me, it used to happen with me also. Lot of, in fact, not 2. There were 3-4 remedies when you repetize a case, and then you feel how to differentiate. And that differentiation will only come with your knowledge of Matermedica. That is very important, knowledge of Matermedica and your knowledge of miasm. So in this way, you will be able to differentiate remedies. Of course, you can always look about hot and thirsty thermals also, and Mathemedica and the knowledge of miasm, you'll be able to easily differentiate remedies. This problem I also had in my practice, and still I have the two remedies come, but I'm able to differentiate by thermals or modalities or miasms and Mathemedica. Sir, share your case of migraine more from your migraine clinic when some patients are commonly seen patients. Yeah, migraine, of course, I have got wonderful results in case of migraine. I just shared one of the case of migraine that frozen sensation. And if you ask me in migraine, it is very, very important to ask the patient what caused too much excitement in the patient. What caused too much excitement in the patient, too much uneasiness in the mind, and that's why the blood supply increased so much and there was so much pain. That is how, and each case of migraine I've seen in my practice does give you a PQRS symptom, a very, very vague symptom. Sometimes the patient comes and tells you, I feel as if the head is filled with sand. Sometimes the patient will come, I feel the head like the river is there and the waves are coming up and down. So that typical symptoms most of the patients have come and told me when we have seen cases of migraine. Thanks to my assistant doctors who take case beautifully, so it makes my work very easy. Dr. Raha says, Salams and hello. I just got a call from a friend, just a baby, 7 few weeks ago, and baby diagnosed with hypertonia. How you'd suggest starting the case, likely prognosis? Rheumatism age of third. Hypertonia means the tonicity is increased. Again, if you ask me a case, a 7 weeks old child, go to the history during pregnancy of father and mother, what happened at that time, that would be the cause and that would be the symptoms of the patient. Look at that child first. How is the child? How is the face? How is the forehead? How are the hairs? How is the child behaving? How was he behaving when I was in the mother's womb? Was he active? Did he have some movements or more movements? So this is the questioning we have to ask to the mother, and then after birth, look at the child, and then you can get some clue of the remedy. So just sharing a case of 9-year-old lost her dog 2 years back and started with having nightmares. 2 months, her grandmother was securitized to an insecurity. Of course, Dr. Disha. No, yeah. So if this is a case where the patient is having nightmares. So you can always have that the fear or the grief which was there because of the death of a dog is still there in the patient's mind, and that's how you have to enter the case and get the remedy. Rheumatism patient 33 dying in hardness symptom, joint ligament with pain but no warmth. See, whenever if you give me an acute symptom of rheumatism on a case there is hardness and drying, you can think about remedies like Ruta or Belispur or Guaiacum or Arenia diadana, or constitutional remedies like Kali iode or Bryonia, or we have Calcaricab, Asafoetida and Moxol. No, if Ignitia 30 has worked, Dr. Disha, then you have to increase the potency and see. The baby is stiff, doctor. But before looking at the baby, you have to see what happened in the fetal life. How was the baby? How did the baby behave? What were the movements of the baby? Then you can get some experience and the thoughts and the mental status of the mother during pregnancy. How to prescribe in migraine? Sometimes there are common symptoms migraine. Yeah. Dr. Indril, absolutely right. And this is very, very common that in migraine, I have seen patient comes and tells you that whenever there is lot of sound, I get pain. Whenever there is strong smell, I get pain. Whenever I skip a meal, there is pain. Whenever I don't sleep, there is pain. Whenever I have woken from the sleep, then I get pain. Whenever I go in the sun, there is pain. What will happen if you prescribe on those peripheral symptoms? Maybe, for example, if a patient says that whenever I am hungry, I get migraine headaches. So you give a remedy where fasting aggravation is there, and the patient says now fasting does not cause me any problem. Now sun causes a problem. So you'll only relieve symptomatically, but you have to go behind the scene. Why did the migraine start? What was the excitement the patient suffers from? Why was the pain so severe, and why there was so much throbbing, and why there was so much congestion in the arteries? That you have to see. हम गुस्से से बहुत गर्म हो जाते हैं. What was the excitement? It can be pleasurable or unpleasant also. And then this is the entry point of migraine, which I have seen in my this 3-4 months of migraine clinic. Fantastic results. Dr. Shoaib, welcome. Dr. Shoaib has joined after a long time, I think. Dr. Sekhar, Dr. Angari, Dr. Shoaib, Dr. Mamta, Dr. Mesh, welcome. So I hope you got some idea about cases of migraine, very active in uterus and born with cord wrapped 3x about neck, but not turn blue, cried immediately at birth. Now, if the patient is active, of course, if there is hypertonia, the tonacity is increased. So it is so important. Like, for instance, I told you something about phosphorus, excitable personality, and after excitement, exactly the opposite part happens. Like, for example, indifferent, apathic, and gloomy. In cases of this type of uh, patients, Dr. Raha, 3 4 remedies that come to my mind are very very important. First is calcarea carb, second is causticum, third is plumbum, and fourth remedy which I have used in my practice is alumen, not alumina, alumen, that is potash alum. These 4 remedies, you go to a mathematical, read the case, and the remedy lies in this part of your uh, case taking. Of course, do ask the mental symptoms or the behavior or the environment of the patient, the child's mother during pregnancy. That is again very very important in your case. Next, I hope few questions I was able to answer. Rheumatism, Dr. Disha, nightmare cases, Dr. Raha, Dr. Indranil. I hope you got some input of whatever I wanted to tell you. The baby is stiff. Yeah, that's because of the spasm. Instagram, I might have, I think, forgot some question. It has scrolled up very fast. So can we have few more questions? Of course, there are questions on WhatsApp, but I'll not take the WhatsApp because it becomes very very then tiring. So we'll basically work on this. Dr. Pithadia, sorry, Dia Pithadia, welcome. I hope I'm pronouncing it right. So as we go further, if you have no questions, you can still ask me questions. One thing I've already seen in CP also. One thing is very very important. Doctor, I think one of doctor had asked me something about migraine. So I'll just please share more cured case of video of Pakistan. Please share more cured video of Pakistan patient. Pakistan. That video of I think okay, I think the large head was there. I think cephalohematoma was there, or I'll check out and send you the video. One more symptom which one of the doctors had told me about migraine. So there is a very important symptom. A CPR patient, remember one thing, note down in your Mathematica or notes. A CPR patient is unable to read in headaches. This is again a very very important CP of a headache, that the patient is not able to read during headache. That is again CPR. Yeah, Dr. Vishal, I know. I'll share that case. Doctor, welcome, Dr. Herbasin. I hope I'm able to pronounce it properly. Sir, how to explore a case when there is paucity of symptoms? Some patients only tell complaints and no other things. Yeah. So immediately when there is a rubric, in a mathematical, in a repertory, talk indisposed to. So if the patient is, or in cases of one-sided disease, as we have seen, the patient cannot tell symptoms. There is a rubric called as talk indisposed to. And if you have seen that rubric, if you have seen that rubric, there are so many remedies. You go to that and you will have about, I don't know how many remedies, 150 to 200 remedies. And in fact, if you see that rubric, you will find some very very interesting remedies like phosphorus or phosphoric acid or naxomica. No, taciturn, no. Talk indisposed to. The patient has disposition not to talk. So we have phosphorus, phosphoric acid, naxomica, veratrum, zincum, I think cocculus, gluonine, pulsatilla, staphysagria, thuja, lot of remedies. But again, I tell you, try to define that symptom. At what, when? During grief, during headache, more in the morning, more in the evening, more in the night. So this is, if you try to define that symptoms, automatically you will get very, very interesting remedies, and you'll get to the remedies very fast rather than taking the whole case. Yeah, welcome, Dr. Palak. So I hope this is, you got some entry point, about how to enter the case. There is no case where we cannot get the remedy, whether the patient tells the symptoms or patient does not tell the symptom. It is upon the doctor's interpretation, his experience, and his knowledge, or Kent says, what does Dr. Kent say? The aura. Whenever a patient is sitting in front of you, there is some aura the patient carries. If you can get the aura, match that aura with the remedy, and automatically the remedy will come. Of course, when you repertorize, there are 3-4 remedies on the repertory chart, then you will be able to differentiate if your Mitra Medica is good. That is so important. Otherwise, there are so many rubrics which have only minor differentiation, but it appears as if it is same. So then it becomes difficult to differentiate rubrics only first. Understand? So in homeopathy, it is very important, if you get the rubric right, then get the remedy right, differentiate the remedy with the help of knowledge of Matra Medica, and you'll be able to prescribe. Of course, it is not so easy, but it is not so difficult also. Can we go further? Dr. Raha, it was an interesting case. I hope you can get us more symptoms about that patient, and we'll be able to discuss that. Some doctor has joined on Instagram. Welcome, 48222017. It is already 3:30, I think, but still, today I could not answer a lot of questions because I was, I think, more bent on thinking about sepia. There are so many symptoms of sepia which I wanted to share. In fact, I get Dr. Raha has said that the boy is stiff. I immediately recollect one symptom of sepia, Dr. Raha. In a sepia patient in delirium sits very stiff. That is a very, very important symptom of sepia. A sepia patient in delirium sits stiff, but that is delirium. Okay, that stiff word just caught my mind, and I got one immediately remedy. The patient sits stiff in delirium, where you can see indifference, where you can see amusement lack of, or these type of symptoms, syphilitic symptoms, grinding of teeth, long time, 15 years. Yeah, see, Dr. Ramesh, one interesting question. This is maybe called as bruxism, and this is always because of some stress. So just if you prescribe only by grinding of teeth, maybe you'll not be able to get the remedy, But as the whole case taking in bruxism, it is because of stress and lot of mental causes. So take the whole case and you get back to us. We'll try to get the remedy for you. So it is already 3:30. I think I was able to, share some of the case and something about sepia. I hope you got something out of the YouTube. If you don't get it, you can always share that what you require, what you want me to speak, so that we can share our experiences on. So until next time, thank you so much for joining.